Well, mounting concerns over Medicaid coverage after the president's spending bill advanced in the House. It could mean major cuts to Medicaid if signed into law, and local health professionals, they're telling us their concerns. WLWT News 5's Daisy Kershaw is live in Westchester with the impacts this could have on patients. Daisy.
Chris, millions of Ohioans rely on Medicaid. I spoke with a counselor here at Modern Psychiatry and Wellness Clinic, and he says if passed, this bill could disqualify many Medicaid users here and leave others with higher medical bills.
No one's really sure when or if this will happen right now.
The One Big Beautiful Bill Act could slash billions in federal funding for Medicaid.
We're kind of running into some issues of preparing for some changes, but also meeting some surging patient demand. So patients have been coming in a little bit more right now because they're also afraid of losing their benefits.
Eric Stone is a counselor and program manager at the Modern Psychiatry and Wellness Clinic in Westchester. He's worried about what the changes could mean for some patients.
Somewhere in the 60 to 70% range of our patients are on Medicaid.
Among those changes, the addition of a copayment for some users.
A lot of the times, the Medicaid appointments, there is not a copay charge of any kind. If they had to pay for each visit, that would be really challenging for them.
The bill would also increase Medicaid eligibility requirements, such as requiring some adults to commit to 80 hours a month of engagement activities, like volunteering or educational programs.
You got about 4.8 million people on Medicaid right now nationwide who are able-bodied workers, young men, for example, who are not working, who are taking advantage of the system.
Stone says these requirements aren't feasible for many.
So there's not an inclusion for caretaker roles or part-time roles. Some of our patients who are caregivers for their family members, they're spending 20 hours a week doing that. That's a big commitment.
Stone also says that this could have a big impact on veterans. He says that over the past few years here in Butler County, veteran suicide rates have gone up, and 1 in 10 veterans do rely on Medicaid. He says that this could impact their access to mental health resources. Reporting live tonight in Westchester, Daisy Kershaw, WLWT News 5.
All right, Daisy, thank you so much.